Greetings, colleagues and friends. Kambria Evans here, the teaching and learning EMDR consultant. And y'all, today we are continuing our conversation about how we are going to rebrand trauma therapy. And this is especially important for those of us who are therapists, who are in what I like to call brain-based modalities like EMDR, or other modalities informed by EMDR like Brainspotting, ART, Flash, all of that. I hope that you will listen to this today. And for those people who are participating in therapy as a client, I hope that these episodes serve you to feel empowered, to understand what you can expect from your therapist and expect from your therapeutic process. Therapy is expensive, takes a lot of time. I want to make sure that you feel empowered to advocate for yourself around your treatment goals and how therapy looks for you so that you can have it on your terms. A lot of us go to therapy because life has not happened on our terms. We've had some traumatic experiences and some symptoms from those experiences. So this needs to be in service to you. So last episode, we opened up the conversation about how we're going to rebrand trauma therapy. And we all agreed that we would stop telling people that they're going to come to therapy and work on their trauma, right? We're not going to keep branding as, the event that happened. We talked about how it's important that we focus instead on what was learned or decided, not really the event itself is as important. And then also noticing and understanding and working with the adaptations we created in response to what we learned or decided, okay? So I want to continue the conversation and convince you 110% that we are not working on the trauma. We're not working on the event, right? It's not about the event that did happen. Or sometimes trauma is about events that didn't happen, right? Like neglect and things like that relationally, or someone not responding to us when we were in trouble. So if it's not about the traumatic event itself, and it is about what was decided and how those adaptations were created, I want to prove it to you, okay? And I have 3 ways today that I'm going to prove this to you so that you are 100% convinced that the joy and the richness of any therapy that's being called trauma therapy should be focusing on what was learned or decided and the adaptations created, okay? Beautiful. So here's how I'm going to prove it to you. So number 1, I often get a question from people and they'll say something like this. They'll say, okay, so you decided to learn something then, and maybe you decided like, I'm not safe, right? Well, what if what you learned then is still true now? What if you're still not safe now? And I love this question because it's real and it's important. And during the pandemic, that was thrown in my face every single day. And I'll tell you why. When you go to EMDR basic training, what do they tell you? They tell you that when you are processing a traumatic event, that you are supposed to help the client distinguish between then and now, right? Well, how the hell do you do that when there is no safe and present time, right? When there is no safe and present time, because especially here in the Bay Area in California, 2020 was a shitstorm, right? We couldn't go to the grocery store. We had to wipe our groceries down because we still didn't understand like what COVID even was, right? We couldn't go outside for, maybe almost half of 2020 because P.S. the West Coast was on fire and we couldn't breathe outside, right? So there was no safe place, right? We couldn't go outside to get food. Toilet paper was running out. Like, I don't need to remind you of all this crap. It was terrible, okay? In 2020, there was no safe and present time, okay? So anyone coming to work with me as I'm figuring out how to do virtual EMDR while the sky is orange outside my office is coming to me to get resourced in safety, but there's no safe and present time to do so, right? So I'm not going to brainwash my clients and tell them, well, no, it's still not safe, okay? But here's what was really interesting during COVID that I hadn't learned in my basic training in EMDR. I hadn't learned it before the pandemic. And what I noticed was that as we processed EMDR targets, right, around safety and control, especially, right, what I noticed was that when we processed the target, it wasn't that the belief went from a negative cognition to a positive cognition, right? Because if we open up an EMDR textbook, it says that we identify a negative belief like I'm not safe when we think about the disturbing event. And what is the positive belief you would like to have instead? Well, if you look at your chart you get in training, it says the opposite of I'm not safe is I'm safe now. Y'all, we couldn't use that one. It didn't make any sense. I was like, shit, now what are we going to do? Right? So here's what we had to do. We couldn't change that negative cognition because there was no safety. Okay. It was really hard to convince people that was going to be a thing we could do. So we did a plan B, which I think informs how we can think about therapy now. We focused instead on the adaptation, the response or urge to what was decided. Okay. So yeah, you're right. It's not safe now. The sky's orange. We can't, go to the grocery store. We can't see anybody. We're all sheltered in our houses. There's no vaccine yet. And what adaptations are showing up? And how do we assess what is helpful versus what is overdeveloped? Right? There was a therapist I was talking to, Jamie Merrick, in one of the podcast interviews I did with her, and she made a joke to me, something like, those of us with trauma histories were like totally prepared for the pandemic because here we are in this traumatic survivalist situation, and we have all these adaptations we could pull out of our back pocket that were actually useful for what was happening now, right? And it was really profound to notice that because what I had to do with my clients during the lack of safety during the pandemic was, okay, and how are we responding to that, right? And what often happened 95% of the time was that we were going back in time to times where there was no safety or no control or power, often as kids, right, with kind of more relational trauma, and pulling out old adaptations, right? For better or for worse. Like a lot of us drank a ton, right? A lot of us ate our faces off, right? I know that for me, one of the adaptations I went to during the pandemic was I ate Oreos again, which I hadn't eaten for since I was a kid, right? But I was trying to find comforting memories or resources within me to get me through it, right? Everyone had this full pass to just survive. Right. So we were noticing these adaptations and that was where the richness was. And we were developing a relationship now with the adaptation that we were pulling from childhood. Okay. That's where the work was. And what's really cool about doing the work this way is that oftentimes people who are in toxic relationships that aren't safe, who are in toxic work environments, like a lot of healthcare workers during the pandemic, just there was extreme danger for them, the most work hours they've ever had, right? Very, very abusive, traumatic situations they're in, right? Very scary, right? So we're just noticing their adaptations and they're developing a relationship with adaptations to survive, okay? And what ended up happening was, not for all my clients, but for a lot of them and my consultees clients, was that instead of gaslighting themselves to believe I'm safe now or this situation is okay, right? This marriage is okay, this toxic work environment's okay. People were just changing their adaptations, changing their responses from when they were little, right? Leaving the relationships, leaving the toxic work environments, making modifications. I mean, look at all the tech workers here in the Bay Area, right? Who are just we're going to work from home forever now because now we've changed our response to you. So the power of therapy, especially for identifying yourself as a trauma therapist or in trauma therapy, isn't necessarily, I have to change, the negative belief of this situation to a positive one. What often happens and where the juice and the richness is, oh shit, the negative belief is actually applicable here in the current time. I need to change my adaptation, right? Or my understanding of what I deserve or whatever the rules are I've created for myself to survive in previous relationships or systems. I need to change those. And then I'll leave. And then the positive belief of I'm safe now might not exist or might exist now. Or I'm good enough will feel true if I'm not being told by my, friends what a horrible person I am, right? Okay. So that's number one. Number two reason to convince you it's not about just the trauma, not about just the event, okay? I was rowing this morning. I'm like obsessed with rowing. It's very, very challenging workout. And I cognitively consciously install positive beliefs with my body when I row that carry me through the day. Okay. This is part of my life redesign. It's going really well. It's a good life experiment. Highly recommend. Okay. This song came on by Eminem, and it was from that movie 8 Mile. And I was thinking about why does it feel so motivating to me, right? Kind of like slowly builds up. And I was thinking about that movie and like how much trauma was in that movie. And I started thinking more about like, why do we watch movies full of trauma? Think about it. Like we go watch adventure movies where people are getting like shot at, blown up. We watch movies about traumatic events. Why do we do that? I'll tell you why. When someone comes out of a movie or watches a TV show and they're like, here's what they don't say. They don't say, oh my gosh, you have to go see this movie. There's so much darkness in it. There are so many hard things that happen in it. It is like really traumatic. That is not where their pitch ends, right? The reason we love watching stories or hearing stories about traumatic events happening isn't the event, right? It's what the character in the story does next. It is what the character decides about herself or the world around her. It is the adaptation, the response, right? The character creates next. That is why we watch that stuff. That is why we love stories about underdogs, right? Because we watch this and vicariously we are internalizing what they're learning in a traumatic event and what they do with it. Okay? This is like the ultimate form of resourcing. Okay? It's so amazing like how smart this is, and I want to make it conscious for you to prove to you that the juice, the richness, the work of trauma therapy is not the event itself, okay? Amazing. All right. The third reason or the third point of why I'm going to convince you it's not just about the trauma, and we shouldn't keep saying that, is this concept of a comfort zone. Okay. I've been thinking a lot about comfort zones, my own comfort zone, my family's comfort zone, my client's comfort zone. I'm like, what is that? What is this phrase we always use? Like, what does that actually mean? Because I feel way pushed out of mine more maybe than ever before. How do I understand what a comfort zone is? Okay, here's what I think a comfort zone is. A comfort zone is the area where your past learning, right, and what you've decided based on what you've experienced and your adaptations agree that it's safe for you to exist there. Let me say that again. That was a mouthful. Your comfort zone is the area of your life where your past learning and decisions about what you've learned and your adaptations you created based on that learning, it's where they say it's safe for you here. You get to exist here. Right? So that's where the power is. Okay. If you're somebody who's like, I want to expand my comfort zone, you could do that in a lot of different ways. Right. But I think one of the problems when it comes to EMDR and art and brain spotting, if we keep saying, oh, we're doing trauma therapy, right? It's not just trauma therapy. We are consciously creating adaptive material, we call them resources in EMDR, for people to expand their comfort zones. That's not just trauma work. That's not just going back to the past and saying, oh, did this happen to you? Okay, let's process it. And now you're in your life. No, this is going into the future template, the future of your life, present time also, and creating adaptive material to expand your positive beliefs about self in the world. Is there anything more powerful than that? If so, please tell me what it is. I think this is why I do EMDR, only EMDR in my practice, why I teach EMDR to my consultees, like why I talk about it on this podcast. The power that lies in this framework and tool is just exponential for people once they understand what it can do. Okay. And this is why I get excited. And this is why I want clients to get excited. I want therapists to get excited. I want therapists to talk about this with excitement in their voices, right? Liven up your websites a little bit. Like stop bumming everybody out, talking and focusing on the trauma. Stop listing all the trauma events that could have happened. No, it's what you learned, the adaptations you created, and then let's build the adaptive material, right? I get so excited about this. I know that y'all can tell. So if we think about expanding our comfort zone, right? A little bit of that is about what happened, but mostly it's about what was decided and what was adapted from there. And once we understand that we can do this, I mean, in EMDR, we call this performance enhancement, right? But we're building adaptive material. We're literally we can create memories, right? Using the EMDR protocol and future template, we're creating memories of the future, right? We are literally using bilateral stimulation, right? Whether it's tapping, buzzers, eye movements, to imagine a future scenario and literally create a memory in your brain of the future. We do this anyway. Like EMDR didn't invent this. Our brains do this. We daydream about the future. When we plan a vacation, oh, that is building adaptive material we can stretch out for months, right? When I'm looking for like a beach trip for my family, it's like this beach house and I imagine us there. And then I look at the pictures and I see us going down to the beach. None of that shit has happened in real life, by the way. This is happening in my head, right? But I'm expanding my comfort zone. I'm expanding what's possible by letting myself go into the future and then consciously installing that, like making it a memory. This is daydreaming. We're just taking daydreaming and future thinking and we're installing it in so it's accessible to our body when we want to use it as a resource, right? In EMDR, they call this performance enhancement. They literally do this with athletes. Did y'all know this? They do this with like Olympians. I do this a lot with like, CEOs who have to publicly speak to their companies and they get nervous about speaking. We run it through in the future with the bilateral stimulation. And I do best case, worst case, right? And when we run the worst case scenario they can ever imagine, right? And then the best case scenario they can ever imagine, they literally see the limits and bounds of their comfort zone, right? Because usually it's somewhere in the middle of best and worst, okay? But we sometimes don't give attention to best, right? To what's possible. And when I get to see people creating memories in my office in the future template, enhancing their future performance, and then coming back and saying, we created that experience in the office. I went and lived it in my real life. And now my body has all of this evidence, right? All of this evidence that I can do X, Y, and Z. Like I have all these positive beliefs that just got affirmed. Okay. So this is creating adaptive material, which is, just so you know, the most important part of any trauma recovery. Okay. Because a lot of our clients come to us and they don't have adaptive material. Like I have a lot of clients come to me and they're just very flat and they'll say, Nothing good happened to me in my childhood. I have a lot of negative beliefs based on real experiences. I wasn't just making this shit up, right? So they make sense. And so I know as the therapist, I am now tasked with partnering with my client to collaboratively create adaptive material. Okay. I'll give you an example. During COVID, a lot of the healthcare workers I supported just were like, I have no control. I'm helpless. I'm not safe. And I was like, I'm not going to lie to you. Like that makes sense, right? You are having an appropriate response, a proportionate response to the trauma that you're currently facing. Okay. And can we be curious about how we can create adaptive material for you to experience a positive cognition now? Where is one place in your life where you do have control, where you do feel powerful? Like, where is that true? It's not at work, right? Everyone's dying in the ICU. It's not there, right? But is there something you can do where you get to experience that version of yourself? Okay. Yes. I had a nurse who was like, I'm going to paint one of my rooms. I forget the color she chose, but she's like, I'm going to paint this room and it's going to look the way I want it to. And I'm going to pick the music I'm going to listen to when I paint. Like, she was in control of all of these decisions. Okay. Now, this isn't trivial because we were consciously doing this exercise so that she could feel in control and powerful somewhere. Okay. And this is creating adaptive material in real time, right? So you can do it in real time and you can also do it in the future. Okay. Beautiful. So I hope that this was convincing. Y'all know I get very passionate about this, but I want you to hear what I'm saying because, and I'll talk about this in a future episode, but I get really upset when I hear a fellow colleague say to me, well, they're not ready to do EMDR or they're not ready for their trauma therapy yet. And I'm like, why? Right? Are they actively coming in completely drunk or on drugs? Like, are they not present? Like, what, like, tell me why, right? Oh, well, they don't have enough resources. And then my next question is, well, what are you doing as a therapist to create those? Well, I had a couple ideas from my EMDR training, but the client couldn't do it, right? So now we're back into blaming, like, here's my rigid protocol and the client can't do it right. So we're not going to go into phase 4 of EMDR and we're not going to process any traumatic events. So we'll talk about this in future episodes, about why this is wrong, what we can do better. And if your therapist is telling you you're not ready for trauma work, if your therapist is telling you you're not ready to do phase 4 of EMDR where we process the traumatic event, you're not going to miss this next episode, okay? I think it'll really expedite your care and help you feel powerful as part of your treatment planning. So thank you for being with me. I always appreciate a thoughtful conversation, and I look forward to being together again very soon. In the meantime, take care.